Hello, how's everyone doing today? I am giving a speech on medical marijuana versus recreational marijuana. What are the risks and what are the benefits? Marijuana is a greenish gray mixture of the dried flowers of cannabis sativa. Slang terms for marijuana is herb, weed, pot, ganja, Mary Jane, and many others. Marijuana can be used in a variety of ways. It can be used to brew tea. It can be used in a vaporizer form. It can be used in medicine, and it can be used in foods, which is also called edibles. The main psychoactive, which is a mind-altering chemical in marijuana, is the THC. THC is also known as delta-9 tetraglycerol cannabinol. The chemical is found on the resin, and it's primarily in the female plants that it's found in. When you eat or drink marijuana, you feel the effects slower, within 30 minutes to an hour. When a person smokes marijuana, THC from the marijuana passes from the lungs into the bloodstream. The blood then carries the THC to the brain and other bodily organs. The short-term effects for marijuana include altered senses, which is like seeing brighter colors, altered sense of time, changes in mood, impaired bodily movement, difficulty with thinking and problem solving, impaired memory, and hallucinations. Long-term effects is breathing problems, increased heart rate, problems in child development, and that's usually with women during pregnancy, intense vomiting, and nausea. More than half of the United States and the District of Columbia have regulated marijuana in some form. Medical marijuana uses the whole unprocessed marijuana plant and its basic extracts to treat illnesses and conditions. The FDA requires hundreds to thousands of clinical trials of human subjects to determine risk and benefits of a medication. And the FDA has not conducted enough studies to fully approve medical marijuana, but the FDA has approved a pill form that contains cannabinoid chemicals. A study on medical marijuana suggests that adult use of marijuana was associated with lower opioid prescribing rates, which was 5.88 to 6.88% lower. One NIDA-founded study suggested a link between medical marijuana legalization and fewer overdose deaths from prescription opioids. The two main cannabinoids in marijuana is THC and CBD. Both THC and CBD have qualities to help with medical conditions. Legally protected medical marijuana dispensaries with the medical marijuana laws are associated with decreased opioid prescribing, decrease in reports of opioid misuse, and decrease in admission for opioid addiction. THC, it can actually increase your appetite, it can reduce nausea, it can reduce pain, reduce inflammation, reduce muscle control problems, and THC is the cannabinoid that actually makes people feel hot. The CBD, it's useful in reducing pain, reduces inflammation, helps control epileptic seizures or any other seizure disorder, helps treat mental illnesses and addictions, and it's not intoxicating and does not give the people the feeling that they're high. Recent animal studies have shown that marijuana extracts may help kill certain cancers and reduce the size of other cancers. Research in mice showed that treatment with purified extracts of THC and CBD used with radiation increases the cancer-killing effects of the radiation. There are two drugs right now that have been approved by the FDA that contains THC, Dronabinol and Nebuline. These are used to treat nausea caused by chemotherapy and increase appetite for patients with AIDS. The FDA approved a CBD-based liquid medication called Epidiolex, which is used for the treatment of severe childhood epilepsy and seizures. Medical marijuana has been approved in 28 states and the District of Columbia. Marijuana is classified as a Schedule I drug. This means that it's a high risk for abuse and lacks any accepted medical use. There has been conducted studies that show that marijuana has been and can be beneficial for medical use. The FDA needs to not classify marijuana as a Schedule I drug because it can be used for a variety of medical purposes. People have used marijuana for a variety of health conditions for at least 3,000 years. The side effects of medical marijuana are dry mouth, impaired mental function, dizziness, heart problems, and blood pressure problems. Under Ohio state law, you are eligible to qualify for an Ohio medical card if you have a qualifying condition, which includes AIDS, ALS, Alzheimer's disease, cancer, chronic traumatic encephalopathy, Crohn's disease, epilepsy or any seizure disorder, fibromyalgia, glaucoma, spinal cord disease or injury, ulcerative colitis, hepatitis C, inflammatory bowel disease, multiple sclerosis, pain that is either chronic or severe or intractable, Parkinson's disease, positive status for HIV, post-traumatic stress syndrome or PTSD, sickle cell anemia, Tourette's syndrome, and traumatic brain injury. Now, all these things right here, the medical marijuana could help with. Schedule an appointment with a certified medical marijuana doctor to obtain your Ohio medical card. If you live in Ohio and you want to get the medical marijuana and have one of these conditions, you can go to your doctor to make sure that you confirm you have a qualifying condition, and the doctor will give you a signed recommendation that will be submitted to the Ohio State Board of Pharmacy. Then you pay $50 to the Ohio State Board of Pharmacy, and they enter your name into a patient registry. Once your name's in that patient registry, then your Ohio medical card will then be emailed to you. I hope this information was beneficial to you, and thank you all for listening, and have a nice day.